All right, welcome back to the show, and we have our guest with us. He's a doctor, and of course, not just any kind of doctor. He's an obstetrician and a gynecologist. I believe that every woman, needs a gynecologist, and his name is Dr. Abayomi Ajayi. Welcome to the show, sir. And he's the MDC of Nordica Fertility Center, consultant obstetrician and gynecologist. Well, I know that when women want to see a gynecologist, you have to wait in line. So if you now want to see a consultant gynecologist,
that's a different thing entirely.
That's a different thing entirely. So welcome to the show, sir. Good to have you on board.
Thank you so very much. It's really good to be here.
Thank you so much. Today we want to focus our talk on infertility, and I'm sure that a lot of women out there have so many questions. I have questions as well, because it's not just centered around women alone. But just to dive right into it, just to to open the conversations, what is infertility?
Thank you so very much. Well, infertility is regarded as the inability of a couple to either conceive or bring forth a baby after 1 year of trying. But there's a caveat to this. Again, depends on the age of the woman. If the woman is less than 35 years, then we wait for 1 year. But if she's more than 35 years, we only say 6 months, and then we should, because there's a biological clock involved in all this. So that's what makes the caveat to be there.
So what are some of the causes of infertility?
Well, we could broadly look at the causes as giant causes like male factor or female factor. Then we have something we call the unexplained. It's not when the wicked have done their work. It's just that we cannot find from our investigations what the causes of the infertility. But the fact is that this couple is unable to have a baby. And then we have what we call the combined factors, when the two of them actually contribute to the pot.
Okay. So is infertility is it, well, like you mentioned, you said it's a combined thing, but how common is infertility? Is it like a race thing? Is it something we see everywhere? Is it particular to a certain region?
Unfortunately, it's not, because it's a global thing.
Okay.
The perception might be different from culture to culture.
Okay.
But it's a global thing. We think about, let's say it depends on the environment, but in this environment, about 25 to 30% of couples suffer from infertility.
25%?
Yeah.
Wow, isn't that a lot?
It is almost an epidemic.
Okay.
So there's a lot of people who have infertility. Now, when we talk about infertility, some people look at only people who are not able to have children at all. But if you had two, you want to have a third one, and you tried for 1 year and it's not forthcoming, you also have infertility.
Oh, wow.
So that is the issue about infertility. That's how it's very common.
So I know that couples try IVF, but let's look at some of the natural conceptions, or more of natural conceptions before moving to IVF.
Yeah, thank you. Actually, that's one of the things that we say, that's why we give this allowance of, say, 1 year if you're less than 35, because we know that the success rate of reproduction, as it were, is cumulative.
Okay.
Every month, a woman or a couple have between 15 to 25% chance of conceiving. So, and that's what people don't look at when they are trying on the bed. That, of course, you don't pay for this. So if you does not succeed this month, you can try another month, try another month. But cumulatively, in about 1 year, if 100 couples are trying to get pregnant, about 75 of them will have succeeded. And therefore, that's why we allow that 1 year before we start looking at whether there's a problem or there is no problem.
Okay. And how do we also relate this to male and female? How is it?
Oh, fantastic. Now, we think male and females contribute equally to infertility.
Okay.
Data might even show that men are contributing more. But we know, that's why I mentioned culture. How we perceive is also influenced by our culture. But there's no doubt that male infertility appears to be actually on the rise globally.
Okay.
There is a study that another one was reviewed earlier last year, where we saw that sperm count appears to be decreasing globally. All right. And they looked at about 40 years and saw that sperm count had reduced about 50% in 40 years. And we actually also did a study in Nigeria where we looked at 10 years. But that was I always tell people to be careful interpreting that, because
the data,
it's a skewed study. We did it in an infertility clinic, not in the community. But what we saw was also almost the same. We compared sperm count of people who presented to us over 10 years. And we saw that in 10 years, the parameters had declined about 30% in 10 years for the men. So there is no doubt something happening to men globally.
So it's not just a woman
thing. Could it be the food? Could it be?
Oh, it's a lot of factors. Food, the environment, the kind of lifestyle we deal with, we live now. I think that's one thing I always talk about anytime I have the opportunity. That our lifestyle is reducing our fertility, both for men and for women.
Okay, so we know that natural causes of fertility, we've heard, and I think I've heard also that studies have shown that there's some types of food that could affect fertility. I say this because there are some people that have claimed that they've gone to a place in, I think it's Osun State, that they've been able to take some type of food that's given them some type of children, maybe twins or thereabout. So does food affect fertility?
Sure it does, because food affects our general health.
Okay.
We say we are what we eat, and that is, it can be true for when you are trying to conceive. Yeah. So there's some things, I think there was the popular place was Ibora.
Ibora, yes, that's
the one. Where they had, we still don't know what is causing the deluge of twins and triplets in Ibora, but some people have linked it to diet, no doubt. Now, but there are things that we know that if you're trying to conceive, we should take, and there's some things that we should avoid. Okay. The things that we should take are the antioxidant-rich things that contain vitamin C, vitamin E, and folate. So that immediately places vegetables in the picture. Nuts. For men, walnuts is really supposed to be good for men. When you're trying to conceive. But that is before you reach that 1 year, because after that 1 year, you now need to start throwing everything into the works and doing investigations. But before you start doing that, maybe your food, you should have to pay attention to your food. And then, and the things to avoid will be excess carbohydrate, especially refined foods, trans fats, like in margarine, like in baked food, like in fried food. You need to avoid such things. And you need to do a little bit of exercise. You need to be a little bit active, so that, because obesity is linked to both male and female infertility. Yes. And then, of course, alcohol, caffeine.
Okay.
You are not allowed more than a cup of coffee if you're trying to conceive. And then drugs, the recreational drugs are a no-no. And what I see here now is that even in the clinic, couples are using recreational drugs as aphrodisiac. All kind of things. And that makes life much, much tougher for us. Because if you are killing your sperm and you want me to give you a baby,
it's tougher, yeah. It's just another organ entirely.
Okay, so what are some of the treatment options available for infertility to overcome it?
Yeah, the good thing in Nigeria is that probably the treatment of infertility is one place that we're probably at par with global standards. So almost everything that is available in the world is present in Nigeria when it comes to fertility treatment. So the first thing we try to say is that have a comprehensive assessment. Let's know what exactly the problem is. And that's one of the things that we say, that treatment of infertility sometimes is customized. Depends on what the problem of the couple is. So couple A might not be having the same treatment with couple B. Depends on what their treatment, their problem initially is. So IVF is possible, ICSI is possible, PICSI is possible. We have all the mix. We can check to see that you are not transmitting genetic diseases from yourself to the offspring. So it's also possible for people who with hemoglobin AS to screen their babies and see that they don't have sickles.
Oh, wow.
So there's so many things that are possible. Almost everything is possible.
It's possible with science.
Except for cloning that we don't do.
I know that they also say that age plays a large role. How true is it in infertility?
Wow.
The woman's age.
Thank you for reminding me.
So
I would have felt very bad if I left it without.
So they say what's the excessive age? The chances, what's your take on that?
Oh, age is about everything in reproduction.
Okay.
Especially for women.
Okay.
Also for men, but especially for women. By the time, and that's one of the things, one of these choices that women need to make. It's a hard choice sometimes. And what we're saying now is that because of technology, even if you don't have a partner, you could store your eggs. If you know, because I'm not going to advise any woman. We know what is happening.
Yeah.
Domestic violence. And I'm not going to ask you to marry a madman. You know what I'm, just because you want to get children. So, but you could store your eggs. But we encourage women to start raising families early enough. By the time you're 30, I think that decision should be probably on your front burner. By the time you're 35, because reproduction starts decreasing sharply
at 35?
At 35 for women. So by the time you're 35, then we need to, if you don't have a partner, by about 33, you really and truly should be thinking of storing your eggs. So
that's
by
why it's a good option. It's really good for women above 35.
I think a lot of women will
yeah. But no, don't let it be 35. So if you can do it about 33, it gives me...
Because every time I feel like women, when you go to the gynecologist, that's usually, or there's some sort of problem.
It's the message.
It's the message they always say. And, you know, you need to... You know, but then you just realize a lot of women who are older now and are not in their late 30s and are not married. They don't have maybe a partner. They maybe have a partner. They're not ready to, you know. So what should they do, or what should be, you know, the way forward? Should it still be the storing egg, or what options are available?
If you know you are not ready yet, then you can store your eggs. But if you cannot store your eggs, why we're saying that you should store your eggs is it gives you the chance of having your genetic children. Okay, because it's not that you cannot do IVF even at 50.
Okay.
But you probably will be using donor eggs at that stage. So if you are so bent on having genetic children, then it's better that you store your eggs.
Let's talk about this IVF process. So a lot of people, some people are aware of it, but I'm sure that some people are not aware of it. So can you walk us through the process of IVF? How quick is it? Is it expensive? And, you know, and also, I've heard that most people that's done IVF often come out with twins, you know, so what is the myth behind all of that?
Okay, thank you. Right, let's go to the process. To start with, IVF does not involve any cut. So there is no surgery involved, per se. We don't cut you. But what it involves is that you take drugs.
Okay.
Some injections, fantastic. And so you produce more eggs than you normally would do. Let me also sound this that it does not bring menopause quickly. So normally what people don't understand that women bring out a lot of eggs. It's only that just one that matures, and then that's the only one they throw up in ovulation. So we use the drugs, we monitor, we pick out the eggs, and then we take the sperm and unite them. And then now whatever you like, you can now do to this at this point. You can store, you can transfer, okay. And then, for example, if you have excess embryos, you could store them from even one cycle. So it's possible for you to have 2, 3 children from one cycle, if you start early especially, and you are in a good clinic where the storage system is good. Okay. So then I think that's just about IVF. Now, the chances of having twins used to be very high with IVF because we're transferring many embryos. But now, we're so sure of our trade now that we're transferring less embryos.
Oh, okay.
Okay, so hardly do you see any very good clinic transferring more than 2 or 3 embryos. You know, that's for older people who even have 3 embryos, usually 1 or 2 now that we transfer. So that limits, and because the whole wide world is trying to reduce this percentage of twins from and higher multiples from IVF, because we know that the uterus was made for one baby.
Yes.
So if you have 2, 3, it's a case of overloading and dangerous driving.
All right, thank you so much, Doctor.
Oh, wow.
Abayomi, but to wrap up, what advice would you give for couples trying to have or to conceive?
Yeah, I think the first thing is that they should, first and foremost, you know, the Bible says my people perish because they lack knowledge. The first thing is that they should try to get a lot of knowledge. Even when you want to see a doctor, every doctor is not a reproductive doctor. Okay. So it's not even every gynecologist that can do reproductive stuff. So you need to be sure that you're taking advice from the right quarters, but at least must be a gynecologist. Okay. And then when you need to do, if you have tried for 1 year, like you said, and it's not working, then you probably need to talk to somebody who knows what to do. And that is, but what I always tell people is that, you know, infertility tends to make people to feel alone. Sorry, you are not in this alone. There's so many people going through this thing that you're going through, and that's what we said. It's about 25 to 30% of married couples are going through this, and therefore seek help and do not be ashamed about it. There is no stigma involved. See, everybody has their own issues that they are nursing. So you have yours. If it's that you're not having a baby, face it squarely and don't let anybody take advantage of you.
Okay, I was just throwing this question very quickly. Misconception, they say that you must give birth like the Hebrew woman, that's natural birth and CS. So, no, we have this, you can't a lot.
Sure.
So what do you think as a gynecologist, Hebrew woman, natural birth or CS?
Are you Hebrew? You're in Nigeria.
Natural birth or CS?
No, see, it depends on, leave that to the doctor. Let the doctors do their work. And please follow the, you know, before I started doing reproductive medicine, I was doing the natural obstetrics and gynecology. And I've seen many accidents happen because women have that notion. I've seen somebody who said, oh, I'm a child of God, so I must deliver naturally. Of course, she ruptured her uterus in the situation. So I think you need to listen to your doctor. And you know that one thing I say about social media, sometimes it does not make people listen to their doctors anymore. They always have opinions about what they know very little about.
To give you suggestions too.
Exactly. So I think they should listen to their. I'm not saying that whatever the doctor says is true or is always right, but discuss with your doctor. Let him tell you why he thinks this is the best thing for you, and have an open mind. And please. Try to follow what the doctor says.
Thank you so much. We've had so much information on this, and I believe that they want to reach you. They can come all the way to the Nordica Center and have a conversation and chat with you. Are you on Instagram, doctor?
Yes, I am.
Okay, what's your Instagram handle?
It's just my name, Abayomi Ajayi.
Ajayi, okay. All right. Thank you so much.
Thank you so much, doctor. Good to have you here.
My pleasure.
Good to have you on board. We need to watch the recap of this on YouTube, when we post on YouTube, to get more information about this. Yes. Okay. So we'll take a break, and when we come back, we still have more trending. We have trending stories for you. We also have more conversations coming up. Don't go anywhere.